In my clinical practice, I have been noticing more and more people coming in with long-term issues after the COVID infection. And interestingly enough, some of those people are also suffering after the COVID vaccines. So by now, most of you have likely heard of the term long COVID, which is essentially referring to symptoms or impairments that persist way beyond the acute infection itself. But what most of you probably haven't heard of is that there's more and more evidence coming out to suggest that the vaccines can have very similar long-term effects. And this isn't to say it's going to happen after your first. In fact, one of the leading theories for why people might react poorly to the vaccines is due to an overwhelmed immune system, which would suggest that it's more likely to happen the more vaccines you get. So that's just to kind of lead into what we're going to talk about today. Today, I want to discuss with you what long COVID is, the various different symptoms associated with it, and what can happen internally to lead to these side effects. And then this ended up being a lot bigger of a topic than I anticipated. So I'm actually going to have to do the vaccines and the similarities between long COVID and post-vaccine reactions in the next episode. So this is going to be a two-part series. But I will say, even if you're here to look at what is happening to you post-vaccines, you're still going to want to listen to today's episode because it's going to lay the foundations. A lot of these internal processes, a lot of these symptoms are very, very similar. So it is very important that if you want to have the full picture, you listen to today's episode, even if you have been feeling a certain way since the vaccines and not necessarily the infection itself. So with that in mind, let's jump into it. First, though, I should probably introduce myself. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada. And now I want to first start by talking about what the potential symptoms of long COVID can look like. So if we look at long COVID, aka long haulers, again, it is the persistence of symptoms well beyond that initial infection. What's really interesting though is it doesn't necessarily have to be the first time you're exposed to COVID. So it could be the second, third, fourth, however many times you got COVID. Just because it didn't happen the first time doesn't mean it's not going to happen the following times. The other thing is sometimes, actually more often than not, the symptoms do evolve and change. So what you initially present with isn't necessarily what's going to persist. The point is you have this never well since kind of picture. You had COVID initially and you have not been well since. Now, long COVID is said to develop in approximately 7 to 35% of people who get the initial infection. And the more severe your COVID presentation is, the more likely it is to turn into long haulers. So say you were hospitalized for a really bad case of COVID, that does increase your chances of developing long COVID. And then the other thing to keep in mind is that your current state of health when you get the infection very much plays a role. So they've seen people who are older, people who have autoimmune conditions, other chronic infections, other things that are compromising their immune system, they too are more likely to develop long haulers. As is with anything in medicine, everything is connected. So you need to take into account what the current state of the health of the person was when they got that infection. And if you were compromised in any way, that does increase your likelihood of this developing into a more long-term issue. And again, a lot of these symptoms can evolve with time and they won't necessarily look exactly like it did in the very beginning when you were first infected with COVID. So some of the most common symptoms associated with long COVID include intense fatigue, breathlessness, cough, chest tightness, heart palpitations, dizziness, muscle pain, brain fog, and difficulty concentrating. Now, a big reason for a lot of the things like brain fog and dizziness are due to an autonomic nervous system dysfunction that happens as a consequence of the virus and the damage that it creates. So one of the more severe versions of this autonomic nervous system dysfunction is something called POTS, which stands for postural orthostatic tachycardia syndrome. And so POTS essentially is when your immune system is dysfunctional and it is no longer able to properly and appropriately regulate your blood pressure. And this leads to a lot of dizziness. It leads to a lot of fatigue, anxiety, heart palpitations, among other things. So that would be a more severe consequence of this nervous system dysregulation, which is happening because the brain becomes inflamed. So we'll get more into that as we go over the mechanisms, but your brain and your nervous system is inflamed, and that can show up in a variety of different symptoms, which all the way go from brain fog and just a little bit of cognitive slowing, all the way to intense dizziness that is to the point where it's debilitating and controlling your life. So there's a very big spectrum when it comes to long COVID. And it's not just your brain and your nervous system that can get inflamed. Your blood vessel lining is also a very common place of inflammation associated with long COVID. What that means is you have an increased risk of clotting, heart attacks, myocarditis, pericarditis, and other cardiovascular conditions, which is a big deal because cardiovascular disease is already the #1 killer globally. So when I see an infection that is worsening those outcomes, I take that very seriously. And it's also important to note that you don't necessarily feel cardiac symptoms as they're coming on. I mean, you'll feel it, of course, if you're having a heart attack, but the low-grade inflammation inside your blood vessel lining isn't something you'll necessarily feel as an overt cardiac symptom. What you might see is your cholesterol rising, your blood pressure raising, some of your inflammatory markers elevating, but more often than not, it's just felt as a vague fatigue, which can be caused by a million and one things. And most of us aren't thinking, oh, I'm more tired because this virus is inflaming our blood vessels. That's not usually the connection we're making. So I only say that to urge you to pursue this further. If you are having this never well since picture, please know that it is important you address this sooner rather than later, because like anything associated with long COVID, it's a cumulative process, and the earlier we can catch things, the better. And if you're just feeling fatigued and some of these low-grade vague symptoms, it still prompts further investigation. And the last thing I want to mention for some of you who are experiencing a more severe manifestation of long COVID, oftentimes that is due to the COVID virus's ability to reactivate another dormant infection inside the body. Now, this is a whole topic of and of itself, but things like Epstein-Barr virus, for example, which most of us commonly know as mono. You will present initially with mono, like most of us do, really tired, sore throat, and then it goes dormant. And it can stay dormant forever, but oftentimes under an acute infection, a different infection, periods of stress, something else stirs the pot, and now all of a sudden that virus is reactivated and you start to exhibit the symptoms associated with that virus or bacteria or whatever other infection has been awakened in the body. So in that context, you can present very broadly. So for example, they have shown that the COVID virus has been known to reactivate infections such as Epstein-Barr virus, which I just mentioned, cytomegalovirus, varicella zoster, which is commonly known as shingles, herpes virus, Borrelia bacteria, which is commonly known as Lyme. A lot of these infections, which are better known as chronic infections, can get reactivated by COVID, and then now all of a sudden you're exhibiting signs of Lyme disease again, or exhibiting signs of Epstein-Barr. So this is really where long COVID can get very broad. The symptoms can span across most body systems. It's not just brain, it's not just blood vessel, although those are the two big areas associated with COVID itself. It can also stir the pot with some of these other infections, and they all have a variety of things that they can create inside the body as well. Okay, so now that we've covered what long COVID can look like very briefly, let's get into how it's doing this. So what is happening behind the curtains that is leading to all of these different symptoms? The first thing to note is that it isn't necessarily because COVID is still present. And in fact, a lot of the times it's not the active virus itself, but the inflammatory cascade that the virus started, but that your body is perpetuating. And they have found that the uncontrolled inflammation is what's leading to a lot of these people's intense fatigue and body pain. One example of this inflammation that is happening in a disproportionately large amount with COVID and this inflammatory cascade is the formation of these thrombin-prothrombin complexes. These are essentially the starting point to a clot. So this will heavily increase your ability to form microclots and bigger clots. Now, this is happening because the blood vessel walls are inflamed. And one thing to note about blood vessel walls and inflammation is that's how you form plaque. It is the starting point, the crucial starting point to plaque formation inside the arteries. So the more inflamed your blood vessel walls are, the more plaque you will form. But more importantly, it's not just about the fact that you're forming more plaque, it's actually an unstable plaque. And what that means is that plaque is more likely to rupture and form a clot, a larger clot that will get lodged somewhere else and give you a heart attack or a stroke, depending on where it gets lodged. If it gets lodged in the heart, that's a heart attack. If it gets lodged in one of the blood vessels that supply the brain, that's a stroke. And so what most people don't realize is that heart attacks and strokes, like 90% of the time approximately, are not caused by the growing of a big piece of plaque that eventually closes off the blood supply to that brain or to that heart. More often than not, it's actually a plaque that has ruptured because it was very inflamed, very unstable, and then that clot got caught somewhere else down the line. And so I don't say that to get super technical, but blood vessel lining inflammation is a big deal. In the grand scheme of things, that is how most of us are going to see our demise. And so I take this very seriously, and that's one of the main mechanisms behind long COVID. Another very well documented way that COVID is leading to more long-term problems is through damage to the ACE2 receptors. So the ACE2 receptors are actually how the virus will get into other cells, but along the way, it will also damage those receptors. And now this leads to a whole cascade of problems, one of which is dysfunction to your mitochondria. Now, I don't have time to go over the mitochondria in any depth, but I did do a whole episode dedicated to that called Tired, Optimize Your Mitochondria for More Energy. And as the name suggests, your mitochondria is very important for energy production. It's called the powerhouse of the cell because it's how you make energy. It's very important in longevity, anti-aging medicine. The mitochondria is massively important, and it's through damage to the ACE2 receptor, along a couple other things, that is really leading to this mitochondrial dysfunction and the other side effects that happen as a consequence of mitochondrial dysfunction. So this is yet another way that COVID is creating problems in the body more long term. Long COVID has also been associated with a ton of immune system dysfunction. Now, there are a lot of different aspects to this, but two of the most notable are dysfunction to something called our mast cells and dysfunction to our immune cells that play a role in autoimmunity. So if we look at mast cells, they're more commonly associated with allergic-like symptoms, say seasonal allergies, for example, a runny nose, itchiness, things like that. And mast cells are actually found all throughout the body. But what they do is they release inflammatory compounds that lead to these symptoms. So in the case of mast cells on the skin, they will release these inflammatory compounds that give you hives. red, itchiness, elevated bumps on the skin. Now, we have mast cells, again, everywhere in the body, including mast cells in our blood vessel lining, perpetuating the inflammation there. We also have mast cells in our digestive tract, which can lead to a lot of digestive symptoms like nausea, diarrhea, things like that. There's actually a condition associated with the dysfunction of these cells called mast cell activation syndrome. So if you really want to dive into it, that is what you can look up. And it, again, has a very wide array of different symptoms that it can present with. And one of the things that it can be causing that is very well known is POTS. Again, referring to that autonomic nervous system problem that leads to a lot of fatigue, dizziness, and things like that. That can be driven by these mast cells being way too easily triggered. And that's essentially what the COVID will do, is it will make them release way too many compounds inappropriately. They have a function, but now they've become dysfunctional and they're releasing things at inappropriate times and way too much of it, leading to this uncontrolled inflammation that we see associated with long COVID. The other thing we see is a lot of these cells, like B cells and T cells, that are involved in the process of producing antibodies can also get dysfunctional. And what this leads to is autoimmune attacks. So autoimmune conditions are when your immune system is attacking your own tissue rather than what it should be attacking, which is foreign invaders like viruses, bacteria, parasites, things like that. And a big reason COVID can trigger this is through something called molecular mimicry. And you actually see a lot of different viruses and bacteria doing this, where there is something about the COVID proteins, the proteins within that virus, that look similar to the proteins of your tissues, for example. And your immune system becomes overwhelmed, confused, and it starts thinking it's attacking a virus because it looks kind of similar to some parts of your tissues, whether that be attacks of your thyroid, attacks of your gut. There's a lot of different autoimmune conditions out there associated with attacks to different types of tissues. And they have found with long COVID, a lot of these people have elevated antibodies against your own tissue. And so that's another way your immune system is being manipulated by the virus and creating this long-term dysfunction. And the last mechanism that I want to mention is the mechanism associated with viral persistence and more permanent changes to the gut microbiome, which is so important. I think I've done a few episodes about the gut microbiome and how it's related to various different things like mental health. But the gut microbiome is very important, and it's another thing that is affected by COVID and associated with long haulers or long COVID. So I know I said not everyone who has long COVID has viral persistence, meaning it's not necessarily suggesting you have an active virus still inside of you. Well, sometimes it is the case, and where it can persist, or at least where they've studied and found that it can persist in people with long COVID, is the gut microbiome. So they've done samples of the gut So research has done studies where they look at samples from the gut and found that people with long COVID more often will still have COVID found within the microbiome. Another thing that they've noticed is that the COVID virus can shift the microbiome itself. The microbiome is a very dynamic thing, which means that it responds a lot to its environment, how inflamed the gut is, what you're feeding it. It can be damaged by some of these chronic infections like COVID. Mold can do it. Yeast can do it. A lot of things can take over the microbiome. You can kind of think of the gut microbiome as a survival of the fittest, super competitive environment. So if a really strong competitor gets in there, it can wipe out a lot of the good bacteria and create a shift which would be more bad bacteria or viruses or parasites and less of the beneficial ones. And that's what we're seeing associated with long COVID, is you start to see a reduction in your good beneficial bacteria, which is a big problem because these beneficial bacteria will release compounds that benefit our health. So it's not just a localized issue. Our gut is very related to our overall health. And a lot of that has to do with the fact that these bugs will release either good compounds that promote good health or bad compounds that perpetuate bad health. And so the microbiome shift associated with long COVID is very much in favor of bad bacteria, with sometimes COVID itself being in there, and a reduction of your good bacteria or your other beneficial organisms. It's not just bacteria that live inside your gut microbiome, but it all can shift and change. And so that's to say that that is another place that we're looking when we're trying to help people get over long COVID, recover from long COVID. You can do microbiome tests and have a look at that. And again, the gut is just massively important. It's commonly referred to as our second brain, which means it has a heavy influence on our mental health. It is where 80% of our immune system is found, so it has huge implications on our overall immune system. And so this is another area that is compromised by COVID. Okay, so that is already quite a long episode. Those are some of the more well-known mechanisms behind long COVID. And as we're going to get into with part 2, there is some overlap between those mechanisms that are also associated with poor vaccine outcomes. And so stay tuned for that. If you have any questions about today's episode, some of the science discussed here, and if you even want to just share some of your personal experience with long COVID, that is always helpful for other people to see. Thanks again for watching, and I look forward to seeing you in the next video.